Thank you, Mark. Our next speaker is Tom Wildsmith, who is an actuary with the Hay Consulting Group. And Tom has had a broad experience with health insurance, working for what used to be called the Health Insurance Association of America, now America's Health Insurance Plans, and now works at Hay, helping them with their health insurance analyses. So thank you very much, Tom.
My next book is going to be a set of jokes to tell while your PowerPoint slides are recovered. I think that'll be a bestseller.
I need that book.
Yeah.
That's going to be a lot.
There you go.
I'd like to thank InHealth for the opportunity to be with you this morning. I feel a bit like the odd man out this morning. I'm not an academic. I'm not an economist. I have no particular expertise in healthcare technology. So I'm an actuary. I've been pricing and helping develop health plans for 28 years now, roughly. At bottom line, I'm a finance guy. So I can't speak authoritatively about medicine or medical technology. What I can tell you is how actuaries and health plans and insurers think about medical technology. The one thing that colors absolutely everything we do is the rising cost of health care. It colors everything we do, it colors the way we think about things, and it shapes the way the insurance markets work. On a very fundamental basis, simple example drawing from life insurance. It's the reason that health insurance is annually renewable term, if you will, instead of whole life. Because those costs increase every year, and consumers don't want to pay this year for health costs 20 years down the road, and even if they did, we couldn't price it right. I've often been struck by how sophisticated the models that pension actuaries and life actuaries use, especially compared to the models that I use and other health insurance actuaries use. You know, it's pretty easy. We can fairly accurately predict death rates out for 20, 30, 40 years. We can predict disability rates, not quite as accurately, but we're pretty good at it. Trying to estimate what healthcare spending is going to be for more than a few years is, I think the phrase used earlier was a fool's errand. And that's absolutely true. Sometimes we have to do it, the projections are useful, but we're kidding ourselves if we think they're anything more than an educated guess. So that uncertainty swamps pretty much every other aspect of our modeling and our long-term projections. One of the key factors that drives increasing healthcare spending is new technology. Why do we care? This is one of my favorite examples. Dr. Garber's talked about some others, the cost of the Medicare program, the cost of Medicaid. But the primary reason so many Americans don't have health insurance is they simply can't afford it. Income is the single best predictor of whether you're going to have health insurance coverage or not. I like this example because it's a simple one and it affects real people. How do we think about medical technology? Frankly, in many cases, we don't. We really don't care what technology is used. Our primary job is the financing of healthcare, not understanding how it works. So what that means is that actuaries, insurers, health plan sponsors, the guys at CMS, the people who try and figure out how to pay for Medicaid, they don't really care how the technologies work. They just want to know that the technology does work, that it's truly needed, and how much it costs. So this is something that, I'd just like to be very honest and upfront about. The primary role of insurers is the financing of care. In a very real sense, they're financial intermediaries. don't get me wrong, there are other functions. They're very important functions. We negotiate with providers. We try and find ways to improve quality. We try and police waste and fraud. We try and encourage the best use of care. But at rock bottom, what health plans do is they organize financing.